Hey, welcome! It's Ashley from Demystifying Your Health. I'm so glad you're here. Today we're going to be talking about high cholesterol. You just got your most recent blood work back, and your HDL is high, your LDL is low, and your doctor tells you this has something to do with your cholesterol. You know that high cholesterol is bad for you, but what does this have to do with your numbers? Let's find out. So before we dive into the numbers, we have to understand what cholesterol is. It's a waxy substance found in the lipids or fats of your bloodstream. It's carried around by proteins. So this compound is called a lipoprotein. They're actually essential for building healthy cells. The problem is when you have too much, because it increases your chances of heart disease. Well, how does it do this? It comes down to the two main types. The first is low-density lipoproteins, or LDLs, and the second is high-density lipoproteins, or HDLs. As the LDL is traveling through your bloodstream, it's actually leaving cholesterol behind on the walls of the artery. This causes that space to narrow and can actually cause it to be blocked. This increases your chances of having a blood clot, a heart attack, or a stroke. This is why LDLs are often referred to as the bad cholesterol. HDLs, on the other hand, as they're traveling through your bloodstream, are trying to pick up all that cholesterol that's left behind. This is why they're often called good cholesterol. It's important to note that you might not know if you have high cholesterol because there are no symptoms. The only way to know for sure is to have blood work done. This is often referred to as a lipid panel because besides LDL and HDL, you're going to get your total cholesterol level and your triglyceride level, which is another component of cholesterol. Your doctor will recommend when to start these screenings, and as long as your levels are normal, you will only need to get tested every about 5 years or so. If your levels aren't normal, you're going to need to get tested a little more frequently. Let's take a look at what those numbers are. Alright, so when it comes to your HDL levels, you want to keep one thing in mind. You want the number to be higher. Because it's the good cholesterol, you want more of it, right? So if your number is less than 40 for men or less than 50 for women, that's considered poor. If it's 50 to 59, that's better. But if it's over 60, that's the best. Alright, so now let's talk about LDL. And the key thing here to remember is you want lower numbers. Since this is the bad cholesterol, you don't want much of this. So if the number is under 70, this is good for individuals who have heart disease and diabetes. If it's under 100, that's optimal for those individuals. If it's 100 to 125, that's near optimal for healthy individuals. And it's high though for heart disease folks or those with diabetes. If the number is 130 to 159, this is borderline for healthy individuals and high for those with heart disease and diabetes. If the number is 160 to 189, that's high for healthy individuals and very high for those with heart disease and diabetes. And anything that's over 190 is high, very high for anyone, regardless of your health status. And the key thing to remember between the two of LDL and HDL is that with HDL, because it's the good cholesterol, you want a lot of it. So the high density lipoprotein, you want high numbers. With the LDL, since it's the bad cholesterol, you want low numbers because it's the low density lipoprotein. So low density, low numbers. High density, high numbers. Okay, so what about total cholesterol and triglycerides? What should those numbers be? For total cholesterol, if the number's under 200, that's desirable. If it's 200 to 239, that's borderline. And if it's above 240, that's high. For triglycerides, if it's under 150, that's desirable. If it's 150 to 199, that's borderline. And this of 200 to 499 is high, and anything above 500 is very high. We know what cholesterol is, we know what normal numbers are supposed to be. Well, if your cholesterol is high, how do you treat it? Well, the first step is a simple step. It is diet and exercise. Your doctor will ask you a bunch of questions about as far as what your current activity level is, what your current diet looks like, and then make suggestions as far as different changes you can make that will hopefully improve your cholesterol levels. They'll usually give you a couple of weeks to implement these changes and then recheck your blood work. If your levels improve, that's great. Just keep up with those changes. If not, this is where medication comes in. Your doctor can help you decide which medication will work best for you. There are many out there, and depending on your circumstances, health history, and other things, they will guide you in which one is going to be the best option. So when it comes to preventing high cholesterol, it's pretty much the same as treatment. You want to focus on diet and exercise. Those are the two key factors. So when it comes to diet, you want a low-salt, heart-healthy diet. This basically means you want to focus on a lot of whole grains, veggies, fruit, good sources of seafood, and try to limit how much saturated and trans fats you're actually taking in, and replace those with unsaturated fats. Well, saturated fats are like red meats, processed meats, non-skim milk, non-fat dairy products, and trans fats are fried food, margarine, commercially processed baked goods, basically all the yummy stuff, right? Unsaturated fats are olive oil, canola oil, almonds, pecans, walnuts, avocados, those sort of things. So start incorporating more of that last group into your diet while trying to limit or reduce how much of the first two groups. The other big factor is trying to drink alcohol only in moderation, if you drink alcohol at all. And then, when it comes to exercising, you need to start at a comfortable level, because if you try to do too much too soon, you could end up getting injured. You should also always see a doctor to make sure you are fit for exercise, or at least the routine that you want to try, prior to starting it, because sometimes your body might not tolerate it, and your doctor can help guide you in a better way. And the other last big factor is to not smoke or vape. This can actually contribute to your arteries hardening, which make it even harder for it to clear cholesterol. So when it comes to cholesterol, it's more than just saying you don't want high cholesterol. In general, you don't want high LDL cholesterol. And when you keep this in mind, you can help see where your diet and exercise play a critical role in this. By doing everything that you can, then you're not going to have to deal with it. Thank you for joining me today, and stay healthy.